Hi, my name is Linda Carell. I'm a Unity Hospice nurse and case manager. If you're watching this video, I'm going to assume you're interested in hospice nursing and what that may look like on a day-to-day basis. I'm going to take you through some of the steps of what I personally do to start my day and go through my day and then end my day. The start of my day. I wake up, I kind of ease into my day. At 8:30, we get an email that comes out of all the telephone calls and on-call visits that were made overnight. And I look at those and I kind of triage my day, see if anybody needs an urgent visit. Then I start making my phone calls.
Hello.
Hey Bob, it's Linda.
Hi, Linda.
Hi, how's Kim doing today? All days are different and they're all unique and wonderful, and one of the nice things is you can kind of tailor your schedule to be what you'd like it to be. Typically I have anywhere from 12 to 18 patients in my caseload, and I usually see 4 to 5 patients a day. On average, my patients are all 15 to 20 minutes away from each other. Sometimes further, sometimes closer. It really depends on the day. There's also mileage reimbursement, which is fantastic. I have a Prius, and so I probably make money on mileage. After I've made my calls and mapped out my day, I make my lunch and I head out the door. My first patient this morning, she's an elderly lady, she's in a facility. Her hospice diagnosis is late effects CVA, which is a stroke. This visit will be to check in with her, seeing if she has any pain, and if she does, how that's being managed. I usually get a set of vital signs, blood pressure, pulse, respirations, and temperature. And I always call the daughter during my visit, which she always appreciates. And if there are any other needs that need to be addressed, I would contact the appropriate team member. And that includes a social worker, spiritual care, CNA, supervisor, triage team, medical equipment company, and pharmacy. Every hospice nurse has an interdisciplinary group team, which is fantastic because you always feel supported. So I just finished up my visit. I'm in the car right now and I'm going to complete my documentation since it was a pretty quick, straightforward visit. I've got her chart opened up on my phone. Charting is quick and easy. You can do it on your phone, you can do it on a tablet. I also have the option of going into the office to use one of the computers there. If any medications need to be called in, if any medical equipment is needed, I do it in the room. That way the patient knows that I'm doing it and they can just kind of get it out of their head. It's done. Yeah, so that's charting in a nutshell, and it's incredibly efficient. Now that I finished my first visit, I texted my second visit saying that I'm on my way. This visit is going to be about anxiety. A lot of this job is active listening and emotional support, sometimes dealing with admissions and recertifications, a lot of education for the family members. And so that's going to be something that I'm going to address today. And after this visit, I have 3 more visits scheduled. I usually finish my visits around 2:30, 3, or 4 o'clock, depending on what needs to be addressed during each visit. And after I finish my last visit, I head home. So I'm just getting home. I get home around 3:30 or 4 o'clock, depending on how long my visits last. And then when I get home, I finish up my charting in about 45 minutes to an hour. In hospice nursing, you do have on-call visits. So on-call varies from hospice to hospice. I do 1 on-call visit a month, and I actually love those visits. I get to see other people's patients. They are people that really need to be seen. They're either having symptom management issues or they're declining, and they need daily visits. But I love those. I love hospice nursing. I'm incredibly passionate about end-of-life care. End-of-life care, for me, is the most important care during somebody's incredibly sacred time of their journey. Thank you for watching this video. I hope it was informative. If you are interested in more information, please contact unityhospice.com and check out our career opportunities. We would love to have you be part of our Unity family.